Hi, my name is Dr. Heintz. We are here to kind of walk you through some processes of chemotherapy. Going through, this is Sarge. Sarge was diagnosed with osteosarcoma on his right front leg, on the lower part of his leg, incidentally after a fracture, a traumatic fracture, when he was running and playing in the yard. From there, we discovered that he had the cancer and ended up electing going for surgery and removing the affected limb and starting him down through a course of chemotherapy. He's done very, very well with the courses that he's been on right now. He had a little hiccup right to start with on the initial therapies, but we kind of changed our protocol a little bit to try to fit what suits best for him. And he has really been rocking right along with everything that's been going on with him right now. He's been a super patient, but the goal today of the video is just to kind of walk through some processes of what this entails and hopefully dispel some stressors that people might have if their dogs are approaching into or having issues with cancer, and kind of some things that you can expect and kind of walking through these things. So usually when they come in first thing in the morning, we'll get a blood sample which has already been taken. It's running through the machine right now, and that is, we check that blood for several different reasons. To make sure that they're healthy enough to undergo the chemotherapy, their kidney function, livers, and all those kind of things work the way that they're supposed to in regards to the chemotherapy, and we don't want to stress them too hard. It is a very toxic drug that they get, and we want to make sure that their body's able to metabolize it the way it's supposed to. In regards to also checking their white blood cell count, which is kind of gives an indicator about how that chemotherapy is affecting the white blood cell production, and if things are too low, then we talk about foregoing chemotherapy this round or just delaying it. But that kind of gives us a good basis about his overall internal health on things that we just can't look and see. But we'll start with the physical and just kind of look him all over and make sure that his gum color and his mucous membranes and all that stuff look excellent, and his eyes are fine. He's not showing any problems there. Also give him a chance to help relax and get reacclimated with one another. He's been coming by about every 3 weeks or so for his round of chemo. It's good that we can kind of just reestablish a little bit of a friendship so he can have a little bit of trust in what's going on and not be too stressed out. Feeling through his belly, make sure we don't feel anything different in there, pain or potentially some masses or anything that's discomfort in there that would cause us to look deeper at certain things. Also feeling all over his lymph nodes, making sure that nothing there is popping up that's not supposed to be there. And also talking with the owners, getting a good thorough history and seeing how things went after the previous chemotherapy dose. After his previous chemotherapy dose, make sure the appetite and attitude and all that stuff was not too severely affected. And if they got a little extra stressed or they didn't do so well from those, we can talk about changing potentially drug dosages, maybe even frequencies of administrations and that kind of stuff. So a good history and talking with the owners as much information as we can provide the veterinarian. It's just far better, going to provide your pet with just so much better care, so much better care. So paying close attention to the details and those kind of things is awesome. Listen to his heart, any changes from last time, any murmurs or arrhythmias. Sarge always had a good heart too. Also listen to his lung fields, making sure there's any crackles and wheezes and different sounds in there that should not be there or that weren't there last time. Sarge is always such an excellent patient too. He's very compliant with everything that we need to and want to do with him. We'll test his compliance here in a minute when we go to take his temperature. And his lungs sound great. So physically, overall, things look really, really good so far. It seems like for him, sometimes this is the most stressful aspect of it for him. Make sure that he's not running on temperature. That's more elevated than it should be. Oh, you took that good. Show here. But the whole process today, his temperature is 102.8. The high end of normal for a dog is 102. So 0.8 of a degree increase above the high end of normal. I don't get too concerned with that on the dog that otherwise physically looks good. We'll consider that as we review his blood work too and make sure that there's not an increase in his white blood cell count that may be telling us that he's dealing with potentially an infection somewhere. So our blood work will help kind of decipher whether that 0.8 is anything that we need to get too concerned about. Sometimes it's just the trip up here from home, a little bit of stress or anxiety, and that will increase their temperature a little bit. So 0.8 is not too bad. Still, as of where I see right now, things look good enough that we can forge ahead with our chemo, but we'll wait and make that determination on to what the blood work says. So next step past this would be, after we review his blood work, is get an IV catheter in one of his legs and start him up on some fluids prior to his chemo, and then go from there.